We are here today at the Helen Rodriquez Award Breakfast for the Latino Caucus for Public Health at the annual event for APHA in Philadelphia. And I'm honored to be here today with the award winner for today's breakfast, Dr. Carmen Velez Vega. Vega, yes, and I think you have a nickname, so
Mili. Everyone calls me Mili. It's much easier.
Great. You're from Puerto Rico,
Yes, I am.
and it was very engaging to hear your talk this morning. Share with us a bit about your background, your work, and what led you here to Philadelphia.
Sure. Well, I was born in New York, like many Puerto Ricans. I'm a Puerto Rican born in New York. I lived there till I was 10 years old. And I come from a family of working class people that taught us that to feel proud of our heritage. As I said, I was taught to read and write Spanish before I went to school when I was in New York. So for my family, it was important to have pride in our heritage and to know our mother tongue. So that was something that helped a lot when I went back to Puerto Rico when I was 10. So I'm a social worker by training. And I've worked in the area of social justice for a very long time. I teach at the University of Puerto Rico School of Public Health. I'm on the faculty of the doctoral program in social determinants of health. And I'm also a researcher in projects that that study the effects of contamination on child premature births, and child development. We have two super fun research programs that work with, one is called Protect, and where we study the mothers, and then the second one is Crece, where we study the babies. I also have done work with the hurricane relief and now the construction, and I have had many years working in the area of social justice for LGBT populations.
And you and your wife and your daughter are here at the awards banquet, and share with us a bit about some of your journey.
Sure. We, my wife and I were been together for 31 years to this day. So when we began, we started to think about having a child, and I was the one who gave birth to our daughter. And from the day she was born, we started to look for social justice in terms of her being recognized as the daughter of both of us. So we went through a battle in the courts, assisted by the legal clinic of the University of Puerto Rico. Those were our lawyers, and we were there for 15 years trying to get the first same-sex second parent adoption in Puerto Rico. The Supreme Court in Puerto Rico said no, and after 3 reconsiderations, they still said no. But then came the decision of Overfeld and then the Federal Supreme Court, and that gave us the opportunity because in Puerto Rico, if you are married, you are allowed to adopt a child of your spouse, and spouse has no sex. So we were able to do that, and everyone after us as well in Puerto Rico. So.
Wonderful. It's a big achievement.
Yes.
Tell us more about the determinants of public health for the Latino population in Puerto Rico and throughout the U.S.
Yes. Social determinants of health have to do with our circumstances, who we are, where we live. And for Latinx living in the United States, being the other is a constant struggle. And the policies that serve, and especially in the areas of health and other areas, are not as fair and do not cover all the needs and do not tend to the cultural needs of our people. We are disproportionately represented in poverty. And what is the poverty? Puerto Rico right now, 60% of the people live under the poverty lines, and we know that here in the United States, many of the Latinx families that live here live below the poverty line. So poverty is one of those social determinants that has to do with structure, because you're not just born into it. This is something that happens, and it happens through generations because there are conditions that sustain it. So that is one. The other area is access to health care. We were just listening about, the problem of diabetes, and how there's a big problem in terms of people accessing the adequate medical care, the adequate information, the access to secure food. That is another area of disparity as well. Access to healthy foods and having the money to buy it.
So it's access to healthcare and access to healthy foods, and the structural determinants that force Puerto Ricanos or immigrants elsewhere in the United States into a role of less access.
Right.
Yeah.
Because the economic situation is so difficult, many people have to have 2 or 3 jobs. So where is the time to exercise and live in areas that are food deserts, which are, is something that we were talking about.
Explain to our audience what a food desert is.
Food desert is an area where at least 5 miles around there is not a source of healthy food for you to purchase.
So perhaps bodegas, but not supermarkets, for example.
Places where you can buy canned foods, or that you don't have the transportation to get there, even if there's less of a distance. That is something. Or when you go to the stores that are close, all they sell are things that are, are not as good for you as those that you would find in other places.
And I believe you've done some advocacy work. Share with us a bit about that.
Yes. Well, we are advocating for example, for healthcare professionals to have education in the area of environmental health. We have a lot of difficulty because Puerto Rico has a lot of contamination. We have had 24 Superfund sites, and right now we have 18 that are active. And these are places that the federal government has deemed very contaminated, and that they are entering the process of cleaning them. So this means that these populations have been exposed for years to these contaminants, through the water, through the air. And one way that we are trying to educate people is to tell them where these contaminants come from and what they can do to reduce the exposures. But we need healthcare professionals to become involved. But that is not something that they teach them. So it's something that we are trying to introduce as a piece of legislation where healthcare providers will be obliged to take a few credits in environmental health, so that they can talk about this with their patients and provide them adequate information to prevent exposure. That's one of them.
I believe you're doing some research on one of these Superfund sites. Share with us about it.
Yes, we're studying the effects of contamination on preterm birth, and we are studying this in the northern part of Puerto Rico, which is a karst area. It's a geological area that has water, a lot of water, underground water. And that water is contaminated because that was also the site of many industries that were there and then were gone, but their contamination stayed there. So we find that we found in the early 2000s that Puerto Rico had the 3rd highest rate of prematurity in the world. And it couldn't be explained by irregular reasons, because people have access to prenatal care, and it's not the age of the women. We knew there was an X factor, and the X factor we are finding is exposure to contaminants that are found in plastics and in products that have odors that have artificial, and in the water. That people receive. So we report back to these participants, and we tell them what we found in their bodies, and we tell them how to avoid it, or at least reduce it as possible. We have the restriction that a lot of them are people that live way under the poverty line, so we can't just tell them buy eco-friendly products because they're more expensive. So we teach them also to make these products, to make them out of natural resources. We work very closely with the Silent Spring Institute that is in Salem, in Massachusetts, and they are experts in this area. They have been helping us. They've helped us develop a mobile app so that our participants can see the results and they can see where this contamination has come from and what they can do.
Very interesting. What's going on with the public health of Puerto Rico right now after the hurricanes and, with some of the governmental challenges in the territory? Where do you see things headed?
We have a lot of difficulties, especially economical. Puerto Rico is right now under a fiscal control board. So all of our, the monies that these agencies have are really restricted. There is, what I see is a rise in the civil society to do something. We had over 4,000 people die in this hurricane. And I'm sure there would have been a lot more if we didn't get the help and the support we got from people that came from the United States, from many nonprofit organizations, from many places, including APHA, that came to help us and actually are still there doing this. I see us moving towards, doing things on our own, not waiting for the government to do them, because it's not going to happen. And we don't want more people to die. So we at the Puerto Rico Science, Technology, and Research Trust have developed the Puerto Rico Institute of Public Health. And we're trying to bring together people from private and public sector together to do the things that maybe for the government it's more difficult. We're starting with we have this new project. We have a vector control unit that was initiated when the Zika crisis was in Puerto Rico. This is working very well. It has a community engagement component that goes to the homes and to the communities to help people deal with the vectors, the mosquitoes. And also we have a new program with Medtronic Foundation to set up a workforce of community health promoters that will work with people with complex health needs. The people that actually died during the hurricane, people that couldn't reach our access to health care. But we want to do this in a preventive way. We want to work with them for the long run. We want to be with them, visit their homes, help them develop their emergency plans in connection with their community health centers, with the federally qualified community health centers in Puerto Rico, which are very important. I see us moving towards that type of I wish there was an FQHC in every single town in Puerto Rico, because that is primary health care that has the standards of HRSA and is followed up, and where people can find all the services they need in one single place.
So it sounds like a movement toward community-based public health, independent of governmental institutions.
You're right. You're
Be
exactly
interesting
right.
to see what evolves from that, where the future goes. Yes. Very nice to meet you, Carmen.
Thank you so much.
Yes.